So welcome everyone to the National Kidney Foundation of Wisconsin joint meeting, if you will, supporting our awesome Wisconsin chapter of the Wisconsin Council of Nephrology Social Workers. Next slide, Amanda. This is me on a better hair day. You can see not quite as great and the bangs are gone. So you can choose whichever photo you'd like to do, my Hollywood Squares photo here or my definitely Hollywood Walk of Fame photo there. But it's really my honor to lead this organization and to work with outstanding volunteers, and you'll meet our chair of our local CNSW chapter in just a few moments. But I always try to take a little bit of time whenever I get to meet with our awesome professionals across the state to give them just a little update or a little reminder. So next slide, please. And so those little reminders for those of you today, and also anyone within your networks or within your units, just want to remind you that, believe it or not, November is just right around the corner. And normally, as you know, the second Thursday in November, we always have our annual dialysis symposium. So this year, going totally virtual, but staying with the same format with a Wednesday night program in terms of special offerings. And one that I thought you would be particularly interested in is for those of you that do need ethics and boundaries credits, or for patient care techs, dietitians, nurses, etc. that you work with, please let them know that they're on Wednesday night, November 11th, we have special pricing where you can just register for that particular program. There is a concurrent workshop that is also going on, if you've had a chance to look at the schedule, and that also involves exercise and dialysis patients. So there is a commensurate 6 to 8:30 session, if you will, in terms of happening at the exact same time. The pricing for patient care techs, again, just for you to know and for you hopefully to share with the techs that are in your units or your work environments, is reduced pricing from this. But we are aware that patient care techs also need ethics and boundaries, as do dietitians. Next slide, please. Thursday, November 12th, which is our typical, if you will, symposium date, is a full day program, but we have come up with special pricing because we realize with our current situation, sometimes staffing in units doesn't allow people to join us for an entire day program. And so I want you to take special note when you do look at the schedule. If you're available and the workshops that we're offering on Thursday morning meet with some of your particular interests, your discipline interests, your scope of work interests, we are offering special pricing. So for Thursday morning, you can earn 3 credits and participate in a keynote and 2 breakout sessions. For those of you that might have, your workload might be a little bit easier, you can do the Thursday afternoon, and that includes 2 keynotes and 3 particular workshops. During the workshop times, there are 2 offerings during each of those times. You can go to our website, you can see that there, kidneywi.org. We also, I think Jessica Zeman was an inspiration. So I also need to tell you, we have similar to Speedway, we have a super mega deal where you can actually earn 8 to even 10 credits for actually a reduced pricing. So thanks to Jessica Zeman for her marketing expertise. But I just really want to encourage you to sign up early for this particular event and go to kidneywi.org and take a look at the workshops. We're really grateful that Stephanie and Melissa Fry have been on our planning committee, and they might have comments about how great some of the extra workshops are. We are tackling racial inequities during one of our keynote presentations. There's an emphasis on home hemodialysis. I think our dietitians or the dietitians you work with will find the sessions on plant-based diets and gut health of particular interest, because our committee aggressively, and I mean aggressively, went out and because there are no walls in our virtual world, recruited some of the country's best experts. So again, great pricing, reduced pricing for patient care techs. I do have to say that we don't have a great list of patient care techs. So I do rely on folks like you to be our advocates and let people know about this opportunity. Next slide, please. Just a couple of things. I'm sure most of you might be Zoomed or Teamed out, but just a little bit of housekeeping, and you can kind of see that. We do hope that you'll keep yourself muted. I'm sure most of you are in your offices or at the unit, but some of us might be at home. We might have very cute dogs or kitty cats or children, or other folks living with us. So if you'd keep yourself muted, and certainly type in your questions in the chat box. And then as Stephanie indicated, she'll kind of moderate that. We would like to, our speakers have asked us to just let them know because they are working for our government, do need to just kind of keep track. They're not going to stalk you, but they do need to keep track in terms of their outreach and impact as it relates to the state. So it really does help if you can indicate your real name, not your Hollywood name, in the chat box, and let them know again the community that you work in. I think that's just helpful to them, and they can speak to that a little bit more. Next slide, please. And it's really my great pleasure to introduce one of the most amazing professional volunteers I've had a chance to work with, and that's Stephanie Nickel, who is the chair of our Wisconsin chapter of the Council of Social Workers here in Wisconsin. So welcome, Stephanie, and I'll turn the program over to you.
Thank you, Cindy. That was very kind of you to say. But I just wanted to also thank Janet Prokop, because she's the one who connected me with Elida, for us to have this opportunity. I think that we all could benefit from learning more about this. And so we have Megan here today to give us her expertise. I see that she's been working with public affairs for over 15 years. She is a public affairs specialist covering much of northern and central Wisconsin. Megan is based in Peru, Illinois, and she's been in her current position for over 3 years. Oh, wait, did I mix that up? You haven't been in your position for 15 years. Sorry.
Been with the agency for 15 years, yeah. Yes. I cover a lot of northern Illinois, and then Elida covers most of southern Wisconsin. Yeah.
Southern, okay. And then we have Elida, and she is a public affairs specialist covering the state of Wisconsin. Elida is based in the Milwaukee office, and she's been with the agency for over 20 years in the public affairs position for a few months. So I really appreciate that you guys are willing to give us this opportunity, because I know that, you know, sometimes we always have questions like this and then stay on hold with Social Security for minutes or hours sometimes trying to get our answers. So I'll leave it to you two now.
Okay, can you see my screen okay?
Yes.
Great. So I'm going to start off. I'm going to go through some basics. You might know some of these things already, and Elida's going to get in a little bit into the real intricacies of the ESRD program specifically. But I'm going to start with going over an overview for you. At Social Security, we want everyone to know we're with them throughout life's journey, from the time that we do the Social Security card number as a baby all the way up through retirement. And of course, we're with individuals if something unexpected happens with our disability program. So with ESRD, of course, some patients are continuing to work and they might not be interested in applying for disability, but there are others who are medically unable to handle working because of the condition, and they might look to file for our disability program in addition to looking at the ESRD for Medicare. So we're just going to go through a little bit of overview as far as our disability goes. So first off, what our definition of disability is, because Social Security is very specific in our definition of disability. It will not be the same criteria that maybe Medicaid or the veterans or anyone else looks at. We do have our specific rules. So for Social Security, what we're looking at is if somebody can work and make a substantial income. So for us, and what we're looking at is if the impairment is going to prevent them from working at least 12 months at a substantial level, or of course, if it's an impairment that's going to result in death, so a terminal illness. And that's our definition of disability. I'm somehow got my papers out of order for, it goes up every year what our substantial gainful activity is. Elida, do you remember it off the top of your head?
I have it right here for 20.
Yeah, I
for
just
20.
Thank you.
You have it?
Yeah, so
it's 1,260.
Yeah, and then that goes up a little every year. So it's a dollar figure for us rather than, that's what we're looking at first before we're looking at the medical condition. If someone is gainfully employed and working above that, then they're generally not going to have a medical decision for Social Security. Now, if they're close to that amount, we go through a work activity report with them to see if maybe there's some things we can exclude. Maybe they're really not working at that level, but that's our pretty strict definition of disability. And with everything, if we have a cost of living increase, all those amounts go up. So that is going to be a little higher for 2021. And again, it has to be that long-term criteria where it's preventing work for at least a year or resulting in death. Now for Social Security disability, so this is what people are paying into with FICA taxes, kind of like getting your retirement benefit early. Then for Social Security disability, we're looking at 2 different earnings tests to see if they're insured for the disability program. We're looking at most recent work. So generally when someone's over a certain age, they have to have been working and paying into the system about 5 of the last 10 years. And then we're looking at overall work. So if they have enough work in their lifetime to qualify for the program. Now, with all of our disability program, as someone with disability of blindness or visual impairment, there are different rules for that. So if you ever come across somebody dealing with that, there are some different criteria we're looking at with them. But for all other disability, generally, this is the same. And again, this is our Social Security program that someone's working and paying into. So of course, someone young is not going to need much work to qualify as far as having the basic earnings for the disability program. They need to have about a year and a half. But as someone gets older, the more they age, the more work they're going to need to qualify for being insured for Social Security. So anyone between 24 and 31, they need to have worked about half of the time period to be insured for the disability program. And then once someone is over 31, we're looking at that 5 of the last 10 years and having a certain overall number of quarters for work. So that's Social Security disability. We do have 2 different programs we pay out a benefit based on a disability on. So we have Social Security disability, then we have supplemental security income, or what most people refer to as SSI for short. For SSI, it does not matter. Someone can have never worked and paid into Social Security and still get SSI. The definition for what we consider a disability is the same, whether they have a condition preventing that substantial work, but the other eligibility requirements are completely different. For SSI, we are only looking at the individual's income and resources, as well as the income and resources of their spouse, or if they're a child of their parent in the household. That is for disability. It can be any age. We also have SSI just based on age for individuals who are 65 years of age or older. Of course, we also have it for individuals with blindness or visual impairment, in addition to other medical conditions. And the rules for the children getting SSI are different. For children, we look at their function relative to other children their age. So different criteria when we're looking at that disability decision, of course, for children, since they're not working yet. For SSI, these are just some of the examples we're looking at for income and resources. We really go through everything with them on an application, but the most common forms of income we might see are wages, net earnings from self-employment, or if someone works for a sheltered workshop, income for that, for earned income. Unearned income, just a few examples. Again, we're going to look at everything. Our Social Security, veterans benefits, unemployment, interest, pensions, and we also look at if cash from family and friends. So if somebody is giving them cash to pay their bills, we're going to look at that assistance as a form of income. And then resources, again, pretty much everything is going to count except for the home in which someone lives in, their highest. So if they have multiple vehicles, it would be the car that has the highest value generally that we're going to exclude. And then if they have burial plots and very specific policies on resources set aside for burial that are prepaid, we can generally exclude, but we have to go through our policies and review those. So for resources, an individual can have $2,000 above and beyond those excluded resources before they would no longer qualify for SSI. If they're married and living with their spouse, then that limit would be $3,000. And then one other thing we look for SSI is someone's living arrangement to determine how much we might be able to pay them. If someone's living in someone else's household and they're not paying fair share of bills, they're going to be due less money. If they're in an institution like a nursing home where Medicaid is paying for it, then they're generally only due $30 a month if they have no other income. And then we have other policies for individuals in care or board and care facilities, things like that. So those are the two different programs. So we have Social Security disability that is based on someone's paying into Social Security. We have SSI, which is based on income and resources. They both need that medical decision for disability. Somebody might qualify for us to send the application down for just one or the other, or we might send an application down for both to see what decision comes back to us. And that's at the Social Security office. All we're doing as far as the disability process is screening for that first part, which program someone would be eligible for, and then we're sending it for the medical decision. Now, even though we're looking at a long-term disability, so a disability expecting to last at least a year or result in death, somebody should really apply as soon as they become disabled. They don't have to be off work for a year already to file. They just need to have some medical evidence and file indicating they're expecting to be off work for at least a year, or it's going to be a long-term disability. The application process can take anywhere from 3 to 5 months, sometimes even longer, honestly, than that. And sometimes we can process the application faster if the person provides us medical information up front, medical records. They don't have to do that though, because we're going to use a release that we're going to send to the medical sources to go ahead and request their medical records. Now, as far as how do you apply for disability benefits, the easiest way to apply for disability benefits is right on our socialsecurity.gov website. If a person's not able to file online, they can call the 1-800 number to set up an appointment for the local office. Right now, that appointment would be done by phone. We're doing very limited in-person. As you can see, Elida and I are actually in our homes right now, but everyone is still working. Everyone's still taking appointments. It would still be with the local office, but it would be a phone appointment. Now, as far as SSI goes, it might be able to be done online. And if you meet the criteria, if someone meets the criteria listed below, or if they cannot do it online, they can still do the Social Security disability part online and mark that they want to file for SSI, and then someone will follow up with them to take that SSI application. Once we have reviewed the record, we've loaded the applications, we've decided whether somebody is going to be applying for one or both benefits, then what we're going to do next is we're going to send it to our disability determination service in the state. For Wisconsin, that's located in Madison, and the person there is going to be making the medical decision. So we mentioned earlier, cute dogs. My dog isn't being cute right now. She gets annoying sometimes, but I'm going to go bribe her with a treat. I'll be right back. Okay, sorry about that. So when we send this decision for a medical decision with the adjudicator, what they're going to do is they're going to confer with doctors and specialists in regards to the condition the person's applying for, and review all the medical evidence that we're going to get from the doctors, hospitals, and clinics that the person lists as part of their disability application. They're going to take into account all that information and when making a decision. They might also have a person do a consultative exam, which is working a little differently sometimes right now, but it is often part of the process for a doctor contracted by Social Security to be part of the process of the decision as well, as far as just weighing in. But that adjudicator is the one that makes the final decision on the case. So what's going to happen in regards to notifying about a decision is for Social Security disability, we're going to send a letter either way. We're either going to, the disability determination service is going to send either denial letter, or the claim will be processed through as an award based on things that we've done in the office, and an award notice will be sent out. The only time we might have to follow up first is to make sure if there's been no work or something since we did the application. But generally, there's going to be a notice sent out pretty much right away. And if it's approved, it's going to show the amount of the benefit and reporting responsibilities, all those things. Now with SSI, we usually need to recontact the individual to go through an update of the application before we can send out that award letter. So that would involve an updated interview with somebody at the local office. If it's denial though, they will also receive the same letter right away from the state agency that made the decision. If the claim is denied, it'll explain why the claim has been denied, and it'll give appeal rights. Now, these appeal rights are really important. So we encourage everyone to file an appeal if they're not back to work, you know, at a substantial level. The reason this is important is, first of all, of course, the time frame we mentioned already, you're at 3 to 5 months at least for initial decision usually. The next level of appeal is the reconsideration. It takes about the same time frame. And then we have above and beyond that, if that one is denied as well, we have a request for a hearing. So those levels of appeal, as long as somebody appeals their initial decision, say they started today on this process, and they're going to get denied, and if they appeal, they're going to keep going through that process. And say they take a year or down the road before they get a favorable decision, we're going to look back to when we first started this process back this month to look at any back pay. But if somebody stops the process, they're basically saying they agree with the denial by not appealing, but then they change their mind 3-4 months down the road and they file all over again, they're starting at that new date for their back pay. So that's why we really do encourage everyone who's not returned to work substantially to follow through on that appeal process. And those levels of appeal can be done online. And now I'm going to turn things over to Elida to start talking about our Medicare program.
Okay. Will you turn the slides?
Yeah, I'll do the slides.
Okay.
This is your first one.
Oh, sorry. Okay. So Medicare and Medicaid. So Social Security has Medicare, and Medicare, to be eligible for the Medicare, there's several ways, but basically it's for people who are 65 years or older or have been on disability for 24 months. So after the 24 months, they automatically are given the Medicare card. It comes in the mail and they use it if they want it or refuse it if they decide they don't want it. At age 65, it's not automatic unless somebody is already receiving benefits. Otherwise, when you're getting close to age 65, we ask you to file for the Medicare. Medicaid is a program through the state, and in the state of Wisconsin, if you are on SSI, you automatically get the Medicaid. You don't need to file or do anything differently, but there are states where it's not automatic. So depending on what state you are, like Illinois, there it's not automatic. But here in Wisconsin, if you're on SSI, you will, we have an arrangement with the state where you will get the Medicaid automatically. Okay. So to be eligible for Medicare, like I said, you have to be age 65. And the Medicare is only for the person who is the worker. It's not for the spouse. It's not for the family. It's only for the 65-year-old worker. You can also get it after the 24 months of being on disability. Again, only the worker gets it, not the family. If you have ALS or Lou Gehrig's disease, you could be eligible for the Medicare. Or if you've been exposed to some environmental hazard, health hazards, you could also qualify for the Medicare. And of course, the one that we're going to talk about today, the kidney failure. Okay, so we have two types of Medicare. The one that, the original Medicare is the Medicare Part A and B, and that's the one that you pay the monthly premium for the Part B, but you don't automatically get the prescription drug plan with that. For the prescription drug plan, you would have to apply for that on your own, usually through your pharmacy or some other private plan, but it doesn't come with the original Medicare. So the original Medicare is just the Part A for the hospital, the inpatient portion, and Part B for the medical part. The Part D you get on your own through a private plan. And then you can also get a supplemental insurance, or what we call a Medigap. And that would be for the original Medicare if that's what you choose. Original Medicare is only good in the United States, and you can go anywhere where a doctor will accept the Medicare. For the Medicare Advantage plans, also known as the Part C, the A and B is also the same. A is hospital, B is medical. The difference with these plans is that most of these plans will include the Part D, the prescription drug plan, and there also are other things that are included, such as vision, hearing, dental. You'll hear what they call like silver slippers, silver sneakers, silver sneakers, where you may be able to go to a health club, and it's covered, part of it, by the Medicare Advantage plan. These plans have lower out-of-pocket costs, but because these plans are within a network of doctors, you're not able to go anywhere you want. So if you're going to be going on vacation, you know, to different places, if you, in the summertime or in the wintertime, you go down and live in Arizona, this Medicare Advantage plan may not cover you there because the doctors and hospitals there may not be in the same network. So that's one plan that you kind of have to know what's covered under each Medicare Advantage plan and what's not, and where the coverage is before you make that decision. Social Security's definition of end-stage renal disease. ESRD is an irreversible damage to an individual's kidneys so severely affecting his or her ability to remove or adjust blood wastes that to maintain life, the person must have either a regular course of dialysis or a kidney transplant. Okay, so this is the form, the 2728, and this is the form that is sent to us by you, and the CMS 43 is the actual application for the ESRD Medicare. So when we receive the 2728, without the application, we will contact the claimant. We'll reach out to them and we'll attempt to contact them to take the application. If we get a hold of them, we will key the application right into our system. We'll use the 2728 and go ahead and process the benefits. Sometimes we receive the 2728 without the 43. In that case, if we're not successful in contacting the person, we will send a 6-month closeout letter using the date that we received this form as the protective filing date. So if later on we are able to get a hold of them within those 6 months, we can go ahead and process the application using that date that we received it. If we receive the 43, which is the actual application without the 2728, then we usually reach out to the facility and try to get the 2728. A lot of times that's easier said than done. Many times we are not able to get these on time. We end up denying some of these claims because we've tried and we can't get the 2728. So one thing, and it depends, but in the state of Wisconsin, we kind of talk to all the field offices and we all agree that when we get the 2728 and the CMS 43 together, it's much better because that way we can usually process everything at the same time. If we have questions, we can still reach out to the claimant, but things are much easier when we get them both together at the same time. So we really want to encourage everybody, if at all possible, always send the 2728 and the CMS 43 together to us. One other reminder, a lot of times, and I don't know how I don't know how everybody does this, but I know, and I've been reminded by the offices, just a reminder, when you are sending this in, we go by the address where the claimant lives. That's the office that has jurisdiction. So if you can, please go on our website. We have a field office locator tool on there. Type in the zip code of the person who is filing for the ESRD, and please send it to that local office. This avoids the time that we have to spend trying to get it to the correct office, maybe it getting lost or misplaced. If you make sure that you fax it to the office that has jurisdiction of where the patient lives, that saves us a lot of time, long run.
Elida, I am keeping track of some of the questions to address later, but I have a few here specific to the 2728 that maybe we'll go through right now.
Okay.
Okay. First one, 2728 has to be original signed with blue ink, correct?
Well, yes and no. So yes, we've always asked that the 2728 be the original one that's mailed to us in the blue ink. But because of the COVID-19, we have made exceptions, and I talked to the management this morning just to verify we are accepting fax copies.
That was another question about the faxing. And then someone says, do we need to send you the 27, 28 if the patient already has Medicare coverage?
Well, that depends, because when we receive the 27, 28, there's several things that we look at. So it's a good idea to send it to us just so that we can make sure that there's nothing else that we need to do. So the first thing we do when we get the 27, 28, we look to see if this person is getting Medicare. If they are 65 or older and are getting Medicare and there is no premium surcharge, so they're just paying the regular amount without a penalty, then we don't need to do anything with the 27, 28. We usually return it to the facility. But let's say that this person is on Medicare, but because they filed late, there's a penalty. We could process the end-stage renal Medicare, and in that case, there would be no penalty after that enrollment. So it's always a good idea to send them in to us just to make sure that everything's correct and there's nothing else that we would need to do.
That specific topic.
What did you say?
I said, I think that was it specific to the 27, 28. So.
Okay. So to access the forms, the 20, yes. Okay. So Megan's going to show us how we're going to go in here to access the forms. So this is on the website, the cms.gov website. So we're going to where it says the type, well. Okay.
Can you see the actual
so are
website
you going
now?
To, yes, I see.
Okay,
no.
Perfect. Or you
I
still
don't
see my
see the
slide?
actual website.
I have to do a different screen.
Okay.
Okay. Just have to remember to flip it back.
Okay.
You got it now?
Yes. Okay. So this is the website that you will be going. Is that the actual screen, or is that the slide?
See the header or footer for the slide anymore?
It's still there. We'll try to type it in and see what happens.
Well, I'm on the page on the screen I'm sharing.
Okay.
So
this is the website, the cms.gov website, where you would go to get the form, the 43, the CMS 43, which is the actual application. So if you go to the search bar and type in 43 and hit search, then you have to come down and look for the first one is the CMS 43 form, and you open it. You actually have to unzip it. So once you click on that, it unzips and it opens. And this will give you always the current, the latest form, because a lot of times we do get the older versions and then we have to ask for a newer one. Okay, so this is the form. This is the actual application for the Medicare, the end-stage renal. This is the same questions that we would be asking if we were talking to the patient on the phone. So very easy to fill out. Some of the things that I just want to remind you on here, you'd be surprised how many times we get these applications with somebody else's social security number. Sometimes because if it's for maybe a young child who has never worked and is not insured, but because he could be insured through a parent, the parent's number will be on here. Or a spouse who is insured, who the patient is getting Medicare through that spouse, their number will be on here. So you always want to make sure that the social security number on here is the patient's social security. It doesn't matter if they're insured or not, you always want to put the patient's number on here. Make sure that the name, the address, all that is current, because many times we do have to contact them, especially if the enrollment date is not clear and we need to ask questions about that. So make sure that that's correct. Everything else is pretty self-explanatory, you know, just questions, and this form has to be signed by the claimant. Wait, stop. Yeah. Okay. So this form has to be signed by the claimant. It has to be dated. This is where you would put the phone number, the address. And there is, if you go up a little bit, Megan. In this remarks section, if you have any question whatsoever on anything, make sure that you write it here. We will contact whoever we need to contact to get the answers on that. Sometimes people will, you know, oh, I wasn't sure what to put here, and, you know, they'll write some notes on here. We always look at this. This has to be, once we receive this, we scan it into our system and we keep it forever. So it will always be there. So, but most of these fields are pretty easy, pretty self-explanatory. They shouldn't be hard at all. Yeah, so basically, one question that sometimes is missed is the marital status. Make sure that you fill that out, because sometimes we will find out it's blank. We contact the person. We find out that this person may be eligible for the end-stage renal from a spouse's work. So that's important too. And then just put that information in there, and we will try to do everything we can to get, you know, this person eligible for benefits, whether it's from a parent or a spouse. So this is basically the form. Did you get another question that popped up?
Yeah, there was a comment on the 2728 that they have a system that they fill it out in for that form.
And these forms, usually they'll come back to us, and they're almost always filled out correctly, the 2728. And I thought that was because the doctors did them, but I don't know. They're pretty good. Okay. Okay. So what are the requirements for the end-stage renal Medicare? So like Megan talked about before earlier, you have to meet the insured status. So you have to have worked long enough to be insured for this as of the first day of the month when you had your transplant or when your dialysis begins. If you have not worked long enough and you are not insured, you could be insured through your spouse, or if you're a child, you could be insured through a parent. And we will look at this, and that's why it's important to answer those questions correctly, because we always try to find ways for the person to be insured. Okay, and you have to, okay. And in order to get the end-stage renal, you do have to file the application, and we need the evidence, which is the 2728. Okay, so the 2728 is not the application. We need the 43, so that's why we encourage you send them both together. So when does the end-stage renal high start? So entitlement begins the earliest of the following. So there is a waiting period. So it can begin the third month after the month the regular course of dialysis begins. And that's usually what we see most often. It can also begin the first month of a regular course of dialysis if you're doing it yourself. So if you had that self-dialysis training, there is no waiting period, and the renal can start that very first month that you had your training. It could also start the month of your kidney transplant. Or it can start the month as an inpatient in a Medicare approved facility for procedures preliminary to a transplant provided. So if you're in a medical facility prior to your transplant for all those other procedures that need to be done, you can start the Medicare right away, provided the transplant occurs within 2 months of that date.
Keeps moving at me.
Okay. And it can also start the first month of the regular period of a dialysis resumes if the person was on there previously. So if the person was on dialysis and then it stopped so the Medicare stopped, there is no waiting period if you come on within 5 years. So in that case, it would start the first month that the dialysis starts up again. Okay, and the SMI can start. So if somebody's eligible for high, Social Security will deem them eligible for the SMI also, if they don't refuse it. So the SMI will start the first month of entitlement to the high, or either the month the enrollment is processed or the month of filing. So if the person doesn't want to pay back premiums, we are able to start the Medicare with the month that the enrollment is processed. But that's only if the premiums are, the arrearage is for 6 months or longer. And if the individual prefers, that's when we can start the Medicare, the SMI. Okay. End-stage renal disease with group health insurance. So this is another thing that we always run into a lot. So when a person has group health plan, because like Megan said, not everybody who is on dialysis stops working. So if they have coverage either on their own or through a spouse who is currently working, we ask that people be made aware that for the first 30 months after they start their dialysis, for 30 months, their insurance through their job, the group health plan, is going to be primary. So anything that is covered, their insurance is going to pay first. So they need to decide whether they want to have 2 insurance premiums, because they're going to be paying their health plan through work. And if they take the Medicare, they're going to also have to pay the premiums for the Medicare. So what we're telling people and what we always encourage people is talk to your insurance, because not only do you want to know, you know, what's covered, because what your out-of-pocket is after the group health plan pays, if that amount is higher than the premium for Medicare, then you're probably going to want to take the Medicare because you're still saving money. But if your out-of-pocket each month is going to be very low, then you may not want to take the Medicare. So that's something that you want to find out from your group health plan before you decide to not take it. Okay, so the disadvantages of filing with the group health plan. So there is no special enrollment period. So with regular Medicare, we give you those 8 months from the time that you stop working to enroll in the Part B, so that to avoid the Medicare penalty. There is no special enrollment period with group health plans. So if you decide not to take it during your initial enrollment period and you decide to take it later, you're going to be enrolling during the general enrollment period. And when you enroll during the general enrollment period, you have to wait until July of that year for the coverage to begin. So if you don't file, that's one of the things that you have to be aware of. So even if the individual takes their insurance and delays taking the Part B, the transplant would still be covered, but the immunosuppressive drugs may not be. So that's another thing that you have to, that people have to be made aware of when they don't take the Part B Medicare. The advantages of filing with group health plan is that the monthly supplemental insurance premium may be less than your out-of-pocket, and that's what I was talking about, where you need to figure out what your out-of-pocket is going to be, because if your out-of-pocket is more than the premium, then you're better off taking it. And another reason why people may enroll when they're still covered is that they may be close to the the end of the 30-month coordination period. Or the group health plan may be ending. Maybe you or your spouse is no longer working and that coverage is going to end, then you want to make sure that you enroll in the Part B. Okay, So although Social Security does have all the enrollment for the Medicare, we actually, that's about all we do. We do the enrollment and we collect the premiums, but everything else is done through CMS. So this is the website for Medicare. It's medicare.gov. And this is the website that you can go to for information on your coverage, on what's covered, on your bills, on appeals, on your claims, everything related to everything else in Medicare other than enrollment and premiums. You want to go to the medicare.gov website.
All right, so before I switch gears, I'm going to address a couple more questions. One question was if mailed, both forms need to be originals and both need to be signed in blue ink. I would say ideally, yes, but I would guess most of our managers are giving some grace in the situation with COVID, and I wouldn't necessarily think you're going to get it returned to you if it's not in blue ink. And then somebody else answered the question correctly as to why we have the blue ink. It's to make sure it's not a copy. But again, in the current climate, we're going to be as flexible as we can be with taking care of, you know, Social Security matters for people, just because of the difficulties that everyone is going through right now with the pandemic.
Mm-hmm.
So this is our socialsecurity.gov website. It actually has a little bit different on it already right now because we do update it. So generally that big box there is going to be whatever is most current for us. And right now that is actually something covering our cost of living increases. So I had a question earlier that was, what was that figure for substantial gainful activity again? And it was the 1260, I believe, right, Elida?
Yes.
But 2021, if you're interested in what's going to be next year, if you go to socialsecurity.gov and click on that big panel now about COLA, all the figures for 2021 are up there, given we've had that cost of living increase. There's also a lot of great other features here on our socialsecurity.gov website. If you click on the retirement, the Medicare, or the disability, it will take you to not only additional information, but links on how to enroll into those. We have our frequently asked questions. So if you happen to think of more questions later, and like you say, you have some trouble getting through to the offices, maybe check out those frequently asked questions because we do have a lot of ground covered there with them. Now, if I'm not going to switch back and forth again, but if we were live on the socialsecurity.gov website and you scrolled down, there is a contact us button. That will give you the different options on how to contact us, including a link to our field office locator. So if you need to find out, maybe you're not sure what the local office is for someone, or if you need the fax number or the local phone number for the office, those are now all available. If you type in the zip code on our office locator, it'll get you the local phone number and the local fax number. So when you fax those forms, it goes right to the local office, and the management team there assigns them to who needs to work them so that everyone can get that done efficiently. We also just want to promote quickly our My Social Security account, because we're encouraging everyone over the age of 18, regardless of your situation, to create a My Social Security account. We have added secure, if you go to socialsecurity.gov/my-account, you're going to go walk through the steps to create them. They are very secure. We've added extra security as far as needing to put in not only a username and password once you have your account created, but getting a text message or email with a special code to make sure it's really you. The benefits of creating one of these My Social Security accounts: if you're on benefits, there are a ton of options, or even just have Medicare. So say somebody needs their Medicare card, does not have it for the day of their appointment, they can get proof of the Medicare coverage by just printing that right from the My Social Security account, as well as request a new replacement card. So they have one coming in the mail. If someone is on disability, they can report wages. You can get a benefit verification letter. Maybe you even help somebody in your family that's on benefits and they tell you they need, sometimes they call it an award letter. They need proof of income. We call it a benefit verification. A lot of different agencies require these for different programs. You can print it right from the My Social Security account. as well as change address, phone number, bank account, all of those things. But even if you're not on benefits, we encourage everyone to check these accounts out, because you can plan for your retirement, use our retirement calculator to figure out what your best options are. In Wisconsin, if you have a valid driver's license, you can generally replace your Social Security card online. So that is a very nice feature that we have. Or check your earnings records. We encourage everyone to check their earnings records once a year to make sure everything's posted and just review their different estimates for things. And I just got a question in asking, what is the best way for patients to see if they have enough work credits for Medicare? Well, if they've paid into both Social Security and Medicare, they can actually see how many credits they have right from that My Social Security account. It'll give them their number of credits. And if they have enough credits, it's not going to give a number, it's going to give a benefit estimate for their disability or for their retirement. So those can be seen right from the My Social Security account as well. And since you are working with so many people, we just wanted to help you, give you some more information on the Social Security phone scams and see if you can help us pass the word along to others as far as what to do if somebody receives a scam call. So I'm sure you're aware, Social Security has really been the target over the last year or so of these scam calls, and people will end up giving quite a bit of money to these scammers at times. So if you can just help pass along the word that people should hang up and not give, of course, any money or personal information over the phone. Don't wire cash or gift cards or send in the mail, because we are never going to threaten people or demand immediate payment. We're not going to tell someone we're going to suspend their Social Security number or anything like that. And if you are individuals have time, we appreciate if they have a minute to report the scam call on our OIG website. That just kind of helps our Office of Inspector General. They use that information to kind of pinpoint where these phone calls are coming from. Just the phone number and the time of day can even help at times. We do have social media. So if you're on social media, one of the ways you can help us spread the word on those scams and other things is by either following us on Facebook, Twitter, Instagram, LinkedIn, or we have a YouTube channel where you can share the videos and help us get the word out for things like our scam awareness. And we post a lot of other good updates on our social media pages. So as we mentioned kind of in the beginning, I'm in Illinois. So if you have a general question, usually in Wisconsin, you can get a hold of Elida via email, or if it's a case-specific question, we do encourage you, as I mentioned, to contact your local office using that field office locator, and they can answer any case-specific questions that you have. All right. I think there was one question in the chat yet that I didn't cover, and it was in regards to someone had stepped away when we were talking about the medical decision and what we need. We do need medical records for proof of disability, but the person does not have to get the actual records themselves. Especially right now, it might be difficult for them to run around and get those. We do have them sign an authorization where we can get the records electronically. The Disability Determination Service will do that as well. Mm-hmm. I think that covered so far the questions in the question box.
I think there was one more question, unless you answered it and I missed it. Someone asked, is it automatically the Medicare Part B? Is it automatically?
Oh yeah, thank you. Yes, I did have that one written down. Thanks, Stephanie. So if someone is on Social Security and they're on Medicare, yes, it will be automatically deducted and they cannot opt to receive a bill instead. That is by law an action that has to happen where the Medicare comes out of the Social Security. If someone is on SSI only, a lot of times they're not going to have Medicare unless the state is buying it in for them. So they're probably not going to have a monthly premium. But if they're, for some reason, they're paying for SSI, then no, we don't collect that from the SSI check. But generally, somebody who's on SSI is pretty low income. So they're probably going to be having most of their billing handled by the state anyway. But yeah, we do have to collect that from a Social Security check by law.
Is there anybody else that has any more questions for these two? Okay. I hope that you guys can stay on for a couple more minutes for some announcements, but thank you, Megan.
Get one more in just now.
Oh, you did?
Yeah. When a patient receives a bill from Medicare, what is usually their circumstance then? Well, if someone is not on a Social Security check, they're not receiving from us, like maybe they're on the ESRD, but they're not getting a monthly check, they're going to be billed for their premiums. And then also they're going to be billed the remainder of coverage, you know, that Medicare does not cover. Like Part B is generally 80%, and there's going to be some additional coverage with traditional Medicare that they're billed for. So those will come from Medicare directly.
Hey, this is Janet. I just wanted to remind people, when you sign up for Medicare, if you don't have Social Security, encourage your patients to start putting that premium away, because when the computers connect, a lot of our patients get 6 months of premiums that they need to pay, 3 months past, 3 months forward. So it's important that they keep that money saved as soon as they know they were eligible.
Yeah, and so generally the bill is quarterly, but if they start in the middle of a quarter, then it'll tend to be, you know, the 3 months plus the 2 more months. Medicare does have an option for you to have it come directly out of your bank account if you're not set up with us monthly, but that's a form you have to complete with Medicare directly. But they do have an option for that to help with people's budget, because it is very difficult when you get that huge bill for several months at a time.
And that can take 1 to 2 months for them to leg it into your bank account, just so people know.
Right.
The last thing I wanted to talk about is that sometimes, according to the benefit specialists, if our patients have good insurance, you may want to hold that ESRD enrollment, because it opens up a whole nother entitlement for them to get a supplement, was my understanding from the benefit specialist.
And that's all on the private side, so we wouldn't have any input, I guess, or familiarity with that.
Janet, I think they're asking you to repeat what you just said again.
When I've talked to benefit specialists, when I was trained as a social worker, we'd always send in for their ESRD entitlement right away. And one of the benefit specialists said, sometimes you may want to hold that for a later time frame, because when they re-enroll under ESRD versus disability, it's another entitlement period. So my understanding is the private insurance companies, to get your supplement, can't look at your pre-existing during that entitlement. So the benefit specialists are sometimes good to just pull in when you're trying to make the decisions on some of this.
I don't think I saw any more questions come in. Did either of you?
No, I don't think so.
I don't think so. Okay. Well, I appreciate the two of you taking the time to come on and teach us about all of this. And then should they reach out to you guys, or do you guys have other people too? Or just the two of you?
Elida, you want to take that one?
Wait, what are you asking? Like for general questions?
Yeah. Are you two going to be our main contacts? Because usually once people give their name and emails, then we might bombard you.
Well, I'm the public affairs specialist for the state of Wisconsin, and I don't mind if you call me. I don't mind if you contact me or email me. Yeah, but okay. we did give you the link to try to contact your local office if it's a specific case that you're asking about, because what we would do is we would reach out to that office anyway. But for anything general like that, I don't mind at all.
Okay. And then I think we have a few more announcements if people can stay on for a few more minutes.
Okay. Well, thank you for having us.
Yes, thank you for joining us.
Okay, bye-bye.
Bye. So we just wanted to let you guys know about the CNSW meetings for 2021. They are going to be held virtually, and we will let you know about the topics once we get them. So if you can save the date for Friday, February 12th, Friday, June 11th, and then Friday, September 10th. And I think, where'd it go? Was it November 11th that I put down was the symposium for 2021? And then if, as always, if anyone has any suggestions on any speakers that you've either been to or heard about that you think would be great to incorporate into CNSW, please let me know, or you can get a hold of Cindy or Amanda too, and they can let me know and I can try and connect with them.
Probably one last announcement. Social Security really wanted us to do this because they're seeing when we don't help with the 43s, they're getting 43s without the 2728. They're getting 2728s without the 43s. And it just makes a lag time for our patients. And our patients are pretty good at doing that 43 form without a lot of our help. So if there's any way we can help Social Security and our patients be more efficient, if we send those in together, it's sort of a slam dunk and they get it in right away.
And thank you again, Janet, for connecting me with Elida so that we could put this together for everybody. And then I think, Amanda, is there a slide that shows people how to get to their recording in case they want to review the information again? And then in case if you guys aren't aware, maybe you could share the kidneycars.org program, and there's the information for that. And one other thing that I wanted to mention for the symposium this year is that what we're thinking about is now that it's virtual, there are other social workers or professionals who could benefit from some of the programs that we have available that day, and maybe they could get some of their CEUs as well. So please feel free to share to the professionals that are not just in the dialysis world, because I think that they could also benefit from them. Oh, I see some. Okay. Anything else, Amanda?
I don't think so.
I don't think so. Okay. Does anyone else have any questions? Thanks for joining us today.